I still remember the exact moment everything shifted, when a simple warning, one I'd given countless times in my career, was brushed aside as if it meant nothing, and the consequences that followed have stayed with me ever since. If you've ever worked in a hospital, you know the feeling. That knot in your stomach when something doesn't add up, when a small detail seems off, when your instincts whisper that you're standing right on the edge of something dangerous. That night, my instincts screamed, and no one listened. I had been a nurse for almost 12 years at that point, long enough to learn that most emergencies don't start big. They start with something tiny, a subtle change in a patient's expression, a hesitation in their voice, a number on a monitor that flickers just one point in the wrong direction. Small things that build, layer by layer, until suddenly you're standing in the middle of a storm you saw coming but couldn't stop. The patient's name was Ethan. Mid-40s, strong, the kind of man who looked like he never slowed down long enough to let anything catch him. He came in for a planned procedure, something routine, something we'd done dozens of times without problems. He wasn't scared, exactly, but he had that restless energy of someone who didn't like giving up control. When I checked him in, he joked about wanting to be back at work by the next morning. I smiled, told him to relax, told him he'd be fine, because at that point, I believed he would be. And then I saw it. Just a flicker. A brief tightening in his chest, a wince so fast most people wouldn't even register it. But I saw it, and it didn't match what he was telling me. He insisted he felt great, that he just wanted to get the surgery over with. No pain, no shortness of breath, nothing. But the moment he shifted on the bed, something in his expression cracked just for a second, and my gut told me something was wrong. I checked his vitals again. Nothing dramatic. Slightly elevated heart rate. Slightly higher blood pressure than I would expect for someone his age who claimed he wasn't anxious. A number just a bit off here, another a little odd there. Not enough to ring alarm bells for anyone else, but enough to make me pause. I spoke quietly. "Are you sure everything feels normal? No pressure? No discomfort?" He shook his head, gave me a smile that didn't reach his eyes. "All good. Really, probably just nerves. Let's just get this done." He wanted to believe that, but something inside me didn't. So I did what nurses are trained to do. I gathered information, triple-checked, and decided it was enough to bring to the surgeon. And the surgeon that day, well, let's just say he wasn't exactly known for being open to suggestions. Dr. Sanderson had a reputation. Brilliant, experienced, confident. Maybe a little too confident. The kind of surgeon who saw himself as the final authority in any room he walked into. I respected his skill, but I never liked the way he dismissed concerns from nurses, as if our knowledge came from thin air instead of thousands of hours with patients. I approached him with Ethan's chart. "Doctor, I'm noticing some inconsistencies in his vitals, and he seems to be hiding discomfort. I think we should run one more quick assessment before taking him back." He barely looked up. His labs are clean. His imaging is clean. Procedure is scheduled. We're not delaying for nothing. "It's not nothing," I insisted, keeping my voice steady. "He's showing subtle signs." He cut me off. "If something was wrong, it would be in the numbers. The numbers look fine." And just like that, he walked away. I stood there for a few seconds, holding the chart, feeling that familiar frustration burn through my chest. Anyone who's worked in a hospital knows the feeling. Your training and instincts are telling you one thing, but hierarchy tells you to stand down. I could have pushed harder, but I also knew how this surgeon operated. He didn't tolerate challenges, and more than once I'd seen nurses get reprimanded for questioning him. Still, I wasn't ready to drop it. So I went back to Ethan. He was trying to stay calm, but the closer we got to surgery time, the harder it was for him to hide that something was bothering him. His breaths were just a little too shallow. His hands trembled slightly, not from fear, but from something physical. I sat beside him. "Ethan, I need you to be completely honest with me. Are you feeling anything unusual right now?" He hesitated, looked at the monitor, looked at me, then exhaled sharply. "I mean, it's probably nothing. There's just this weird pressure, like someone sitting on my chest, but it's not pain." So I didn't want to say anything. My pulse jumped. Pressure. Not pain, but pressure. Exactly the kind of symptom people write off right before things go terribly wrong. "Ethan, that's important. You should have mentioned it." "I didn't want to mess up the schedule," he said, almost apologizing. "Besides, the doctor already said everything was fine. And that right there. That is the dangerous thing about confidence. When a patient hears a surgeon say, 'You're fine,' they believe it, even when their body is telling them something else." I squeezed his shoulder. "I'm going to run a quick test, okay?" But before I could get further, the OR coordinator came in, cheerful and oblivious. "All right, they're ready for him. Let's get moving." I wasn't ready. I wasn't comfortable. And I was out of time. As we wheeled Ethan down the hallway, the unease I felt grew heavier with each step. The lights overhead were too bright, too cold, reflecting off every polished surface like warning signals I couldn't articulate. Ethan looked up at me occasionally, like he wanted reassurance, and I gave him the best smile I could. But inside, I was screaming. At the OR doors, he grabbed my wrist lightly. "You'll be here when I wake up, right?" I swallowed. "Of course." He nodded, trying to relax, and then he was taken inside, swallowed by a room full of machines and sterile blue drapes, and people who trusted technology more than instinct. I scrubbed in, my mind racing. I tried again, quietly, carefully. "Doctor, before we begin, can we reassess his—" "No," he snapped. "We're starting." And that was that. I had been overridden. Again. As the anesthesia took effect, I watched Ethan drift under, his breathing slowing, his body relaxing. But something still wasn't right. Even sedated, there was a tension in him that shouldn't have been there. Surgery began. Everything looked routine at first. The team moved like a well-oiled machine. But 20 minutes in, the first sign hit. Small, subtle. Exactly like I feared. His oxygen saturation dipped. Just a point, then another. Not drastic, but enough to trigger my adrenaline. "Doctor, his levels are dropping," I said, firm and controlled. He barely glanced. "It's a normal reaction. They'll stabilize." But they didn't. The numbers fell again. Then his blood pressure wavered. Then his heart rate spiked. Each shift was tiny, but I knew exactly what the pattern meant. I'd seen it develop too many times not to recognize it. This wasn't random. This wasn't a normal response. Something was brewing. I stepped closer to the surgeon. "Doctor, I need you to stop and reassess. Something is wrong. These changes aren't normal." He frowned, irritated. "Everything was normal pre-op." "No," I said, my voice sharper now. "It wasn't, and I told you that." The room went silent for a moment. Just a beat, just enough to make his eyes flick toward the monitor. And he saw it, the slow but undeniable downward drift. He stiffened. "Fine. Pause for a moment." Relief washed over me, but it was short-lived, because Ethan's body wasn't pausing. His breathing became shallow, erratic. His heart rhythm flickered in a way no one wanted to see. The anesthesiologist adjusted medications, trying to stabilize him, but each adjustment only held for seconds before the numbers slid again. The surgeon cursed under his breath. Suddenly, he was no longer dismissive. Now he was scrambling to figure out why his perfectly fine patient was deteriorating. He asked for labs, asked for adjustments, asked for more data. But the problem wasn't something happening in the surgery. It was something that had been happening before it, something he ignored. something I warned him about. I watched the surgeon's confidence crack. He kept glancing at me, and every time he did, his expression shifted. Frustration, guilt, something unspoken he didn't want to acknowledge. When Ethan's heart rate surged dangerously high, then plummeted just as fast, the room exploded into motion. Voices calling out numbers, machines alarming, the anesthesiologist raising his voice, the surgeon barking orders, and I stood there, doing everything I could. My stomach twisted into a knot so tight I could barely breathe. Because this was exactly what I tried to prevent. Exactly what I saw coming. Exactly what everyone else ignored. "Get him stable," the surgeon demanded. But by then, the chain reaction was already unfolding inside Ethan's body, and stopping it was like trying to hold back a collapsing wall with bare hands. The alarms grew louder. The team's voices grew sharper, and the surgeon's face turned pale as he realized the truth. We were losing control. And it didn't have to happen. Not like this. Not if he had listened. Not if he had paused. Not if he had trusted the one person in the room who had seen the danger before it began. Me. The alarms didn't stop. They seemed to echo off every wall, each one a reminder that something we should have caught earlier was now spiraling out of control. The anesthesiologist's voice cut through the noise as he called out Ethan's dropping levels. The circulating nurse rushed to adjust fluids. Another grabbed emergency meds. I moved instinctively, my hands steady even though my chest felt tight, my pulse pounding against my ribs. "Come on, Ethan," I whispered under my breath. "Stay with us. Stay steady." The surgeon's calm facade was gone. His voice was sharp, rattled. "Increase the fluids. Now. Adjust the ventilator. I need more visibility." But the issue wasn't something he could see. That's what made it so maddening. The signs were internal, subtle, brewing long before the scalpel touched his skin. Signs he refused to acknowledge. The anesthesiologist suddenly turned toward him. "Doctor, he's not responding the way he should. We need to stop and reassess immediately." The surgeon hesitated, not because he didn't understand the seriousness, but because this kind of setback bruised his ego more than he liked to admit. I could almost see the conflict on his face, the desire to push through, the need to accept reality, the guilt creeping up behind his pride. Then another alarm blared, louder, sharper. Ethan's heart rhythm had shifted again. My breath caught. "Doctor, now!" I snapped, no longer soft, no longer deferential. I stepped forward because someone needed to. "We need to pull back. His stability is crashing." He finally nodded. "Fine. Halt the procedure." The OR immediately shifted into crisis mode. Tools were set down. Drips were adjusted. The surgical field was managed and protected. Everyone moved with practiced urgency, but there was tension in every gesture. The kind that told me I hadn't been the only one sensing things were off. While the team scrambled, my eyes stayed locked on the monitors. Each rise and fall of the numbers felt like a countdown. I could hear my own pulse in my ears. Every minute felt like one step closer to something irreversible. The anesthesiologist administered additional stabilizing meds, but Ethan wasn't responding the way he should. His body was fighting something beneath the surface, something hidden, something that never should have been ignored. The surgeon leaned over Ethan's chest, scanning the monitors, his voice strained. "This doesn't make sense." But it did. It made perfect sense to me. I had spent years watching patients' bodies tell the truth long before their tests did. I had spent years learning the difference between anxiety and a warning sign, between fine and something's coming. And at that moment, all I wanted to do was scream, I told you this wasn't nothing. But this wasn't the time for that. This was the time to fight." "Get me another set of vitals," the surgeon ordered. I already had them. "Here," He stared at the sheet, his expression darkening, and then, without looking up, he muttered it. Barely audible, but clearer than any alarm in the room. We should have reassessed. I didn't answer. What I wanted to say wouldn't help now. Instead, I focused on helping the team keep Ethan stable long enough for him to recover from the sudden storm his body had thrown us into. It took nearly half an hour, 30 long, grueling minutes, before his numbers finally leveled enough to move him safely out of the OR. When we wheeled him into recovery, I stayed by his side. My hands shook slightly, the adrenaline still coursing through me. Even unconscious, he looked exhausted, as if he'd run a marathon he never trained for. The surgeon followed a few steps behind, unusually quiet. As the team settled Ethan into his recovery bay, the surgeon pulled me aside. Not aggressively, not dismissively, just quietly. "What did you see?" he asked. For a moment, I was too stunned to respond. This was a man who never asked nurses for insight, never admitted a crack in his own judgment, never sought anyone else's instincts. But now, he looked shaken, serious, and genuinely curious. "I saw discomfort he tried to hide," I said. "I saw tension in his chest before we took him back. His vitals weren't alarming, but the pattern didn't fit. The pressure he mentioned wasn't normal. It was subtle, but it was there." He nodded slowly, processing. "Why didn't he mention that earlier?" "He didn't want to delay your schedule," I said bluntly. "He didn't want to seem difficult." The surgeon flinched. "Good. Let the truth sting." He exhaled, rubbing his forehead. "I should have listened." It wasn't an apology, not fully, but it was more accountability than I'd ever heard him offer. "I spoke too quickly," he continued. "I trusted the charts more than your assessment. I won't make that mistake again." I didn't say anything for a moment. My throat felt tight, not from anger, but from the emotional weight of everything that had just unfolded. Nurses don't ask for much. We don't expect praise. We don't expect glory. What we do expect, what we desperately need, is for our voices to matter, for our instincts to be treated as the experience they are, for patients like Ethan to be protected by all of us, not just the ones with surgical credentials. The surgeon cleared his throat. "Will he be okay?" I nodded. "I think so." He stabilized. "He needs monitoring, but he should recover." Relief washed over his face, and for the first time in years of working with him, he said something I never expected. "Thank you." Not sarcastic, not annoyed, not constrained, just real. I looked down at my hands, still faintly trembling. Just doing my job. But we both knew I'd done more than that. Hours passed before Ethan started waking up. I was beside him when his eyes fluttered open, confused and groggy. He looked around, panic rising until he saw me. "You're okay," I said gently. "You're safe. We had a complication during surgery, but we stopped in time." He blinked, trying to process. What happened?" I hesitated. "Your body was warning us before the surgery, but we didn't fully understand the signs until things started escalating. You did amazing. You fought through it." He absorbed that in silence. After a moment, he whispered, "You knew, didn't you?" I swallowed. I suspected. I tried to hold things back, but sometimes the system pushes forward faster than it should. He studied me, his expression softening. Not with fear, but with gratitude. "Thank you. For being there." His words hit me harder than he knew. Because those moments, the ones where a patient recognizes your effort, your presence, your fight, are the ones that stay with you long after the shift ends. By the time my shift was over, Ethan was stable enough to rest peacefully. His vitals were holding. His breathing was stronger. His color had improved. He had a long road to recovery, but he was on it, and he was alive because we intervened in time. As I walked out of the hospital, the weight of the day settled deep into my bones. I replayed every second, every warning sign, every moment of tension, every decision that could have changed the outcome. And even now, months later, what haunts me isn't the alarms or the panic or the near disaster. It's the silence before it all, the moment when I spoke up and wasn't heard. Because that's the reality of nursing that people outside the field rarely understand. We stand closest to the patient. We notice the first subtle shifts. We carry instincts sharpened by every person we've ever cared for. But our voices still get drowned out by hierarchy, ego, or the illusion of certainty. I still think about what almost happened. I still think about the moment Ethan grabbed my wrist and asked if I'd be there when he woke up, and how close we came to making that promise impossible. But most of all, I think about what changed because of that day. The surgeon listens now, really listens. He asks for my input. He asks for everyone's. He stopped assuming that numbers tell the whole story. And whether he'll ever say it out loud or not, I know he carries that day with him the way I do. Maybe that's the part that haunts me the most. Not the crisis, but the fact that it took something like that to make a difference. Still, Ethan recovered. He thanked me again before he was discharged, told me he'd never forget me, and as much as I brushed it off, part of me needed to hear it. Because nurses don't always get closure, but I got some that day, and sometimes that's enough. Thank you for listening to my story. If you stayed with me until the end, just know that I appreciate you more than you realize. These stories aren't easy to revisit, but sharing them matters, because they remind people why listening, observing, and trusting your instincts can change everything. If you felt connected to this story, consider supporting the channel. Share this video, subscribe, or send it to someone who loves real experiences from the front lines of healthcare. Your support helps bring more stories like this to life and keeps voices like mine heard.